Hey everyone, let's start over. My name is Hamna. I graduated from Lahore Medical and Dental College in Pakistan. I currently live in Houston, Texas, and work with a physician at Houston Methodist to do some publications. Hopefully, I'm going to be attending the SCCM this year, so I might see Dr. Kashyap there. And I'm a little bit of a confused soul. Every different rotation that I do, I fall in love with it. The only consistency has been medicine so far. And I'm really looking forward to learning from Dr. Kashyap and making progress through research because it can be hard.
Thank you, Hamna. And those who are looking at this video, if you miss a meeting, we are introduction section for faculty and our scholar at this time. I like that you're a coffee snob. I quit coffee 20 years ago. Last coffee in
really sad for you, sir.
At Chennai Central train. That was my last tea and coffee. I loved it. That coffee was phenomenal. All right, next one we have Shiyun Lee. I don't see her here. We're gonna skip it through. Or Shiyun, have you joined us yet? If not, I'm gonna skip you. Then Ayush. You have to unmute yourself, Ayush.
Yeah. Hi everyone, my name is Ayush Haldar. I'm currently a third year medical student at JIPMER in India. My interest is basically in the field of neurology and science. And also currently I have started a research project in epilepsy, and I'll continue doing research in the field of neurology. And my interests are basically currently on systematic reviews, meta-analysis, and review articles. And the reason I joined GRSP is because I wanted to get proper mentorship related to research, and that's why I'm here. Thank you very much.
Thank you, Ayush. Believe it or not, our interests are same as well. Systematic review, meta-analysis, and any different thing. You study and work at night. Somebody commented on LinkedIn. It's one of the leading lawyers in America saying that probably he should sleep more. Yeah. So I think these are good to have those fun facts. Next is Dr. Raghu Gandhi. Dr. Gandhi, you there? Please unmute and then share.
Can you guys see me?
Yes.
Oh. Okay,
everybody can see you.
Yeah. Hello, everyone. I am Raghu Gandhi. I am a child psychiatrist. I work at the University of Minnesota, and I know Dr. Kashyap for the past 2 years, and I'm working with him on some of the projects, and I'm really excited for this opportunity and to learn more about systematic reviews and publish more papers.
Thank you, Dr. Gandhi. We are absolutely happy to have you here today and then in the program. All right. Is it Tamara or Tamra?
Tamara, yeah.
Go ahead,
hi everyone, I'm Tamara Tengo, and you can call me Tamara. I'm a fresh international medical graduate, and I have ever did intercalating degree in neuroscience in 2019. And then my research interests, especially in neurosurgery and neurology, but currently I'm working on antimicrobial stewardships as a research assistant in one of the research institute in my country, because I want to fill my time before internship next year. And then same like other people, my research interests mainly about systematic review and meta-analysis. And I'm looking forward for a proper mentorship so I can become a better physician scientist in the future. Thank you.
Fantastic. Thank you so much, Tamara. That is something we can definitely provide, if not anything else in this regard. All right, Dr. Shweta Sharma, please unmute and then introduce yourself.
Hi, everyone. I'm Shweta Sharma. Currently, I'm based out of San Francisco, and I'm working as an intern as a drug safety physician. So post my MBBS in India, I did my master's in healthcare management. from California State University. And recently, I developed interest in pharmacovigilance, drug safety. So that's where I have been for the past 2.5 years. And research has always been something that I wanted to get more interested in, but for whatever reasons, I couldn't pursue it more after my med school. So, so currently I come back to Dr. Rahul Kashyap, and my main focus of interest are reviewing the case articles and literature review. And other than that, I enjoy my time with my two little kids, 5 and 10-year-old. So they really keep me busy, but I enjoy my walks at the beach. San Francisco gives me a lot of opportunities for that. And looking forward to work with all of you and publish some interesting articles, some interesting papers. So let's see how far I can take this.
Thank you so much, Dr. Sharma. Those who doesn't know, I had the privilege to work alongside Dr. Sharma during our time at AIIMS New Delhi, and then one of the most hardworking and intelligent person I work with. We are very excited, and then Dr. Sharma is taking a path which I'm closely watching, and then that could be a pathway for others who want to pursue their career in pharmacovigilance. That'll be a huge, important perspective you'll be bringing, Dr. Sharma. Absolute privilege to have you.
Thank you so much, Rahul, for your kind words. Thank you.
Absolutely. All right, who is next? Dr. Sharma, another Sharma. There are quite a few Sharmas in this batch today for some reason. Go ahead, Dr. Sharma. And are you still there or you slept? You're muted. Dr. Sharma is post-call. He worked till morning, so I'm not surprised if he have dozed off. Dr. Sharma, you're there? 3, 2, 1, we'll come back to you. All right, then we have Dr. Charu Agrawal, fresh off the boat from Canada to US. She passed through Niagara Falls. I'm just kidding. Dr. Agrawal, go ahead and introduce yourself.
Hi, good morning, everyone. I'm Dr. Charu Agrawal. I did my MBBS from SSMC Tumkur in 2009. And after that, I did my post-graduation in ENT. During ENT, I realized that I enjoyed patient interaction more than the surgical aspect. So I wanted to switch over to IM. And I'll be applying for next year. I moved to Chicago for doing observerships. I am very poor in research. Like don't have a very a research background. When I attended the Q&A session, I realized that I could get the perfect mentorship from here, and which will take me a long way. So that's why I joined this course, and I'm looking forward to learning from all of you.
Fantastic. Tell us about your Rubik's cubes and pyramids. I don't know what pyramids is.
So that's a pyramid-shaped cube, the Rubik's Cube, the 3x3 ones. So it's an interesting thing because I actually joined the classes for my 6-year-old daughter, but she couldn't concentrate and she said that I don't like it. So I already paid for it. So I ended up learning it and I loved it. So then I went on to learn the other cubes. Currently, I'm learning the mirror cube.
All right. Well, probably you can take a lesson or lecture on that at the end of the session.
Sure, I can.
One, I'm going to confess, I thought I did not like ENT at all during my time. And I thought I'll never interact with somebody who does ENT. Like, how can they do so little in so little places, in a sense? I'm so glad that you are moving away from ENT. Not even you try it, I think I'll be supportive, but just a tidbit that my dislike towards, especially for ENT. In a sense, nothing wrong with it, but it's just that I didn't like it much. All right, who is next now? Oh, Shalja. Is this Shalja?
Yeah,
yes, Shalja.
yeah.
Dr. Sharma.
That it is. All right. So hello, everyone. I'm Shalja, and I'm working as a medical officer to put myself through the US Assembly journey, and I am studying side by side. And my interests are IM and family medicine. And if you go in a super specialty, then it would be neurology, without any doubt. And as you see, I have listed a lot of strength. I didn't know that everyone will see that. I would have been a little more modest. Sorry for that. But yeah, fun fact about me, that is totally true. And I will try to control myself with these kind of jokes if nobody likes it. So give me a heads up for that.
Please do it. Then that makes us two. So then I'm not the only one with the poor dad jokes. So absolutely.
All right. So I think that it will be legend. Wait for it, Derry. Get there.
Nice. Very good. I think this is the only far I could go. Let me see. Yes. So let me stop it for 1 second. I would like to continue recording it. I know that many of you didn't get a chance to speak. So, and your slide, Dr. Sharma is back. Welcome back, Dr. Sharma. Let me see if I can share my screen one more time.
I'm sorry, actually, I don't know what happened. I was always here. I've been up.
Oh, that's okay. We could not hear you. So let's go back. Hey, you go, Dr. Sharma.
Hi, everybody. This is Pranjal Sharma. I go long back with Dr. Kashyap here. We are from the same medical college, and it's been really great knowing him. I'm currently working as a nephrologist in the transition phase of moving to Ohio, near the Cleveland area, and I'm really interested in some research in nephrology. Hopefully, it's been a long time, so hopefully we can get ahead from here, at least somewhat.
And I can attest to his fun fact. He has written, I'll do anything and everything to escape hard work. That is so true. From medical school days, in hostel days, I can attest to that fact. So if he finds a way to make research easy, just follow him. That means he has figured out the laziest way to publish a paper, in a sense. So I can definitely attest to that. All right. So rest of you guys, I'll ask you guys to unmute yourself in the order I'll call for it. And then next week when we come, we will start with just those presentations. So I have Saurabh, then I have Mustafa, and then I have Diksha and Pranav, who didn't get a chance. I have the slides from 3 of you except Pranav, but I didn't send it on time. So that's my fault. So Saurabh, do you want to just say a few words and then we'll have your slides next week?
Yeah, thank you, sir. My name is Dr. Saurabh Sharma, and I'm from India. I did MBBS, completed my MBBS in 2018 and did my post-graduation in general surgery from SMS Medical College, Jaipur in 2021. This year, I did fellowship in minimal access surgery. Right now, I'm practicing general surgeon in Jaipur. And my interest is, I like nanoparticles for skin and neural tissue reconstruction and prosthetic limbs. And I'm hoping to get plastic surgery residency in coming months. And I joined this program to learn complicated research methods and process of international publications, and to interact with all the people from different career stages and institutions. I love traveling and watch football matches, and I'm a Manchester United fan. Let's go Red Devils. And this is me. This is it.
Thank you, Saurabh. For some reason, we lost your picture and then my spotlight messed up big time, but that's okay. Next on my list is Diksha Murlidhar. Diksha, go ahead and introduce yourself briefly so then people start curious about your presentation next week.
Hi, Dr. Kashyap. Thank you so much for this opportunity. So I graduated from Sri Ramachandra Medical College, Chennai, and I'm applying for internal medicine residency this year. I did a few papers back in medical school, but I didn't have a proper mentorship or proper guidance about the whole process. So I feel like this is a great learning opportunity, and I'm looking forward to working with all of you and learning.
Thank you so much. That was perfect. Next is Dr. Mustafa Sajjad. Mustafa.
Hello, everybody. My name is Mustafa, and I graduated from medical school in Pakistan. Currently, I'm preparing for my Step 1 exam, which is due next month. I worked previously on multiple studies, which include systematic reviews and meta-analysis. And my strengths include that I'm well-disciplined and I'm good when doing teamwork. Other than this, I enjoy watching sports, and I'm a big sports fan.
Very good. Thank you so much, Mustafa. Thanks for being here today. Many of you know, if you follow us on LinkedIn and Twitter, if not, start doing it, that Fazal and I, we are AI enthusiasts, machine learning, artificial intelligence. We are finalizing a major global project called Humane, which is a checklist for AI and machine learning based papers for the world, in a sense. And that's the perfect segue for me to have Pranav say a few words. Pranav is not a medical doctor, but he brings a cool perspective, and we are hoping to publish some stuff. And those who are in that area and interest will be able to help him out. Pranav, go ahead and introduce yourself.
Hi, everyone. I'm Pranav Sharma. As Dr. Kashyap pointed out, I am not a medical student. I have not been linked to a medical institution throughout my life, right? I have a cybersecurity degree, and my research is going to be in cybersecurity. Similar to Dr. Faisal and Dr. Kashyap, I am also an AI and machine learning enthusiast. So I look forward to talking to all of you, getting to know few tidbits about medical science through you guys, but my major focus is going to be in cybersecurity research.
Fantastic. Cybersecurity, risk management, and then we'll see what comes out of it. I just recently learned the balance scorecard for organizational needs as well. Those are interested in MPH or hospital, administration kind of thing. There'll be enough for everybody else, and we'll learn from Pranav to see how we can take it further. All right, I think this is good. These four who didn't have the slide, and Jenna, sorry, I'm so sorry. Jenna, Assalamu alaikum. Go ahead and introduce yourself.
Welcome, Salam. Hi, Dr. Kashyap and the rest of the team. I'm Zaina. I'm a current PGY3 resident at York Hospital in Pennsylvania, one of the associate organizations that Dr. Kashyap is affiliated with, WellSpan. He asked me to join in, and he did a huge favor to me by letting me join this program and meet and have an opportunity to meet the rest of you guys, because I'm working towards a HEMONC fellowship, and this gives me an opportunity to meet with everybody and get some papers. And I have to say, I have zero research background. I did go to med school in India, and then I started my residency about 2.5 years ago.
Thank you, Zaina. Don't think that you can also get into residency other that Zaina could get in. She has a very different score, but I bet none of you might have that kind of score. I'm not going to reveal that. And then things have changed.
No,
so.
I think Dr. Kashyap is right on point. And I'm in a community program, and I would say having access to research can build your CV and take it to a next level where you have the opportunity to be at the best institute for your career trajectory. So I think there's a lot that can be learned from here. And this is my way to propagate that research is extremely important.
Fantastic. We didn't pay Zaina to say that, but that's exact words from my mouth. All right. Okay, good. And then we'll have everybody's slides, Zaina's, Pranav's, Mustafa's, and Saurav's, and Diksha's. Those slides will be there next week because I have some of them, most of them except Pranav's one. Okay, now we stop the recording. For those who are watching, please go to the second video. We'll be talking about our clinical research 101.